Are we expecting Marge?
Marge did say she was going to come on. I sent the information to her a couple minutes ago. What we could do is we could get started. I can check my email to see if she emailed me as well.
Okay, do you want to take the roll call then?
Sure thing. Hal Etzel,
Present.
Darren Anderson,
Present. Present.
Byron Basser,
Present.
Michelle Finelli,
Present.
and myself, George Needles, present.
Okay, with that, has everybody had an opportunity to review the minutes that George sent out?
Yes.
Yes.
Could we have a motion on the minutes?
Motion to approve.
Okay, a second?
Second.
Okay, thank you. All in favor, please say aye.
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 Opposed? Motion carries. At this point, let's have the health inspector's report, please.
Yes, hi. So I am finished all annual inspections, except one who has not really said she was going to open up the new Matilda's kitchen on Meeting House Road. They've delayed it a couple times, so they asked me to stop by this Wednesday. So hopefully I'll complete that inspection. Other than that, really, it's just getting through this environment with complaints and things like that. I haven't had many complaints, which was good. But my yearly is done until next year.
Good. I take it now that the new requirements from the governor is that all restaurants are closed for dine-in?
Yes, you're absolutely correct.
Okay. Any questions for the health inspector?
No.
All right, George, we have township report.
Sure. So just to give everybody a heads up from the township, so Michelle's done all of her inspections as she stated, and we're getting ready to paperwork to send out for 2021 health licenses. That's an annual item that we do through our license and inspection department. So that's all starting to go through. Most of that's been sent out this past week. From like a COVID-19 perspective, we'll go a little bit deeper into like the whole discussion of the township wise, but from an operational perspective, currently we are operating our offices open from 8 a.m. until noon. And then the staff is sticking around afterwards, but we're kind of rotating our staff to make sure that we have only a couple people in the office at a time, so we can, keep our little kind of groups together in case something does happen, which we did have an incident that we were dealing with in the month of November. The Fury Road Fieldhouse building is closed to renters and to the public at this time. We do anticipate that we're going to try to open that back up in the new year. We're limited to 10 people at an indoor space, so it would be primarily just for people utilizing the walking track. But we're still looking at all the different options to make sure that that's feasible. We obviously don't want to put anybody in a bad situation. The 452 building, we're no longer renting that out at this time. And so we're kind of in a little bit of a hold pattern. The good news is there's plenty of work to be done. It's the end of the year. This is typically a very busy time for us. So we're busy here. It's just that we, some of the services that we typically offer have been modified and changed a little bit. We still are collecting trash. We're still providing police services. Everything's still happening. And then we're doing as needed work for the road work and things like that.
I take it that you're going to be able to handle the snow that's coming?
Yeah, we're all prepped and ready to go.
Good. Sounds like we're going to get somewhere between 5. All right. Any questions for George?
No.
I saw Wayne pop
Okay.
in. Marge, are you on the line as well?
You hear us?
I can hear you guys.
I'm
Sorry to
here.
wait. Yep. Okay.
Okay,
I'm
good.
here.
We're both here. Yep.
Okay, good.
Well, the next thing on the agenda is the emergency management update. Emergency Management Committee had a meeting just before this one. I think the best way to say it is that the Emergency Management Committee is still a work in progress. They're attempting to get new members, working on the emergency plan, which using the old plan and trying to update it to current situations. The one thing we discussed today was about a shelter for the storm should we need one, which would be the middle school. I asked them an interesting question, and that would be is what happens if somebody walks into the shelter and says that they have an elderly couple will say walks in, their house has no heat, but they have a temperature over say 99.5. And what do you do in that case for that particular person who needs shelter but is in a position to potentially threaten the people already there? It was a fairly lengthy discussion on how to solve that problem, and the obvious one was to open up a classroom and allow them to be sheltered, but separately from the group. So it's those kind of tough decisions that COVID-19 forces upon us when we're trying to do good for the community. Other than that, I think that's pretty much it. George, do you have any comment about the emergency management meeting that I've overlooked?
No, I think we're making good progress. One of the items that was brought up was they talked about what would be the protocol if there was a need for a shelter at this point, and they had they had recommended that they bring that to our board. So I did email out to that group, and I'll email it out to everybody else, the CDC guidelines for sheltering during COVID-19 for like disaster shelters. But what we would do is we would kind of default to working with the Chester County Health Department and making sure that everything was set up accordingly. So that was that. But emergency management is tough right now because everything that they prepare for, this whole thing throws a kink into it. So I'd imagine that this group, along with a lot of the township staff, would be asked if they would be able to participate and help out in those kind of situations. Because we would need as many bodies as possible. They talk about screening people as they come in, getting medical professionals on site in case there's issues with people with the virus and things like that. So I'll shoot that information out to everybody, but I think that'd be a good dialogue. So if you have any questions to that email, please respond and let me know, and I can work on getting the answers.
Okay. That leads us into a COVID-19 discussion. The only thing I can comment on is that I've been fortunate up until very recently that since July, we've only had one death related to COVID-19, but obviously the number of cases has more than doubled, almost tripled, hasn't it, George, since July?
Yeah,
I hope everybody. Go ahead, George.
I was just going to say that up until relatively recently, it had only doubled, and then we saw a big jump in the past couple weeks. So,
and I guess we can look forward to high numbers for the next probably 30, 45 days due to the holidays and everybody trying together. And all we can do is recommend that people follow the guidelines of the CDC and do as much social distancing as possible. Does anyone have any comments?
Yes, I do have a quick question. And George, I don't know if everyone else is having similar problems that I'm having. I'm having a difficult time hearing you. I'm not sure if it sounds like maybe it's on my end. One of the questions,
George is low. Your volume is a little low, George.
Okay, I don't know. Maybe you can turn your volume up. That may be helpful. Do we know what our relative risk here is in the township regarding COVID?
well, I mean, overall, just over 3% of the population have had it since the beginning of over the course of the time over the years. So, you know, when I say that it's growing, it's still a relatively small percentage of population that is growing. We're not seeing large gatherings. The places in town where you would typically see large gatherings, we're not seeing them. You know, like Maple Zone Sports is, you know, with the winter and everything, we're not seeing teams play over there anymore. You're not seeing all of the firehouses, halls are effectively been shut down. So a lot of the what are identified as like the areas where they could be super spreaders are kind of we don't really have that going on. So at this point we've not. All of the dialogue between us and Chester County, there's not been any dialogue that we're like a high risk, high area. We don't have, I mean, we do have some senior living quarters, but we don't have any assisted living facilities. We don't have, you know, to the extent of what you're seeing some of the areas where there's spikes. Even to, I know there was an individual in the community that was trying to get another testing facility in the town. And I believe that my understanding is when he brought it to the Chester County Health Department, there just wasn't as much of a need in this area for that because we just don't have the high volumes that we're seeing in some of the other areas.
Yeah, from what I saw, George, we have two testing sites. One at Boothwyn Pharmacy and the other one at Rite Aid, right? Is there another one in town?
There was one set up in the industrial complex behind the township building as well. I'm not sure what the parameters are to be seen there. You know, I would recommend there are places that are set up through the county that you can contact and get a test, and then there are independent places like Boothwyn Pharmacy, Rite Aid, and then I believe it was through Pentech Health, but don't quote me on that, by the township building. So in all those places, you know, if you're going to get tested, we've been recommending everybody go through their insurance company. Which
I've had some contact. Couple of my, a friend of mine has been tested twice, mainly because he was having procedures done. But the delay for testing was like 24 to 48 hours when he was tested. I don't know if you check the Chester Board of Health website for Delaware County, but the numbers for Upper Chichester right now, as of earlier today, were 528 positive cases in town with 11 deaths. I think the only good news of that is that there's only been one death since July, and that's been recent, last Friday. So we're very fortunate in that regard.
Correct. Yeah, those numbers have been updated. I believe it said it was updated as of Friday. Also, just as a note, I had a meeting with the Delaware County Consortium of Governments 2 weeks ago, and we had Rosemary Holt, who is the liaison between Delaware County and Chester County Health Department. And the meeting centered on, you know, the county is working to get a health department up and running. And so what they're going to be doing is setting up more of these facilities for testing for flu shots, things like that, as well as they were working on their plan for distribution of the vaccine, which is my understanding is that if it is not already in Delaware County, it will be in Delaware County very shortly. And they will start with their protocol for delivering the vaccine. And that when she walked through the plan, there's different tiers of, you know, based off of risk and based off of, you know, health and age and a couple different, you know, occupation. And what they had talked about was that the goal was to get the vaccine to a high percentage of people by the end of 2021.
Yeah, from what I've heard in the news lately, it sounds like we're going to be pretty much throughout the entire year before everybody has an opportunity. I guess the older we are, the more chance we have to get it sooner. So maybe I'm on the top of the list here in this group. Okay.
Well, George, what's their priority, George? Who gets it first? Who's in phase one?
So the way that they communicated it to us was that the initial phase was going to be high-risk medical professionals, who are working on the floors with direct contact to COVID patients. So I'm assuming that that's, at the time they were working on the plan, it hadn't been approved yet. And then also into some of these nursing care facilities, the workers for the nursing care facilities working on the COVID floors. There's not a large number of the vaccines distributed. You know, we've seen the numbers. So it's really going to be kind of that hierarchy of the people that are in it every day are going to be getting it.
Okay.
Any other questions for George? Any other discussion on COVID-19? Okay, at this point then, if there are any members of the public listening to this meeting, do you have any questions or comments?
Yeah, if you had called into the meeting, you can press *6 to unmute your phone to talk. Just state your name and your address, and then you'll have 2 minutes. If you have not called into the meeting yet, but you would like to call into the meeting, the telephone number is 571-748-4021, and the PIN is 468-051-088. Let's wait a couple seconds to see if anybody calls. Real quick, Hal, our next meeting, I'm going to try to get Rosemary to be a guest speaker at our next meeting to give everybody here an update of what's going on from the county perspective, and talk about how the communication that goes on back and forth between the municipalities and the county on this matter.
Okay, that'd be good.
Yep.
Are there any members of the public in the call? I don't see any, George. Do you?
I do not.
Okay. Well, in that case, do we have any member comments before we close the meeting?
Good.
Everybody?
No comment.
Everybody
No
knows
comment
it?
at this time. Thanks, Hal, for
Okay.
keeping up with everything and keeping us in step with what's going on. And thank you too,
Well,
George.
I think
Continuing
George
your-
has got to get the credit for that.
Okay.
Yeah, and same here. I'd like to kind of commend the township and their efforts regarding COVID. The mitigation risks, I think they've been handled according to science and public health, and as well as the residents of the township. For the most part, I've seen many people taking precautionary measures. And if it's not for themselves, it's for their neighbor. I see schools are running very smoothly. I'm not sure if there's been any positive tests reported from there, but both of my children are in public school, and I have not heard anything as of now. So I think that the mitigation risk, the executive orders that's been handed down by the governor. I know that many probably do not agree with it, but I know first and foremost, public health is our number one priority. So I just wanted to just be on record making that statement.
Very good.
Yeah,
Anybody else?
I couldn't agree more. Just a
Yeah.
couple notes. Just for everybody, remember to wash your hands frequently as possible. That's the best thing you can do. If you're unable to wash your hands, use hand sanitizer. Wear a mask when you cannot socially distance yourself from other people, and please, practice social distancing as you can. I think those are, some of the things that are going to help us get through this. And I just want to apologize to everybody real quick. I know when we started this not last year, but the year before, we kind of had some lofty goals of how we were going to be interacting with the other departments, and I feel like this year kind of set us back. But once we're able to kind of get back up and running, we're gonna hop back into working with the different departments and collaborating, and we're going to be a very strong Board of Health that's really going to help this township progress. So,
Thank you.
Thank you, George.
Okay, thank you, George.
All right. Well, in that case, I would entertain a motion to adjourn.
Motion to
Motion.
adjourn.
Thank you.
Second.
Very good. Okay. Thank you all.
All right. Thanks a lot, guys.
We are adjourned.
good night, everybody.
Happy holidays. Happy holidays.
All right,
Yes.
thank you.
Holidays.
Stay healthy.
Very
Have a good
efficient.
You too. Thank you.
Thank you.